Good afternoon and welcome once again to our weekly media briefing and public health update with Montgomery County Executive Mark Ulrich. I'm Lorna Virgili, Hispanic Public Information Officer for the county, and joining us today is Dr. James Bridgers, Director of the Department of Health and Human Services, as well as Mr. Sean O'Donnell, Acting Deputy Chief of Public Health Services, Dr. Earl Stoddard, Assistant Chief Administrative Officer, and today we have a special guest, the county's new Chief of Public Health Services, Dr. Nina Ashford. Welcome, Dr. Ashford, and Minister County Executive, good afternoon to you.
Good afternoon, everybody, and welcome to today's media briefing. I'm joining you today from Annapolis. Earlier today, I testified on behalf of the Fair Share from Maryland Act of 2024, and this bill will do several things. It would alter the taxes expected from wealthy estates when a family member dies. It would also adjust the state income tax rates to be more progressive. Right now, our rates are not nearly progressive. And it would address low level of taxation that many corporations currently pay and increases the total state revenue while reducing taxes on the majority of households. And it closes loopholes that affect some very large corporations that pay little or no taxes. So I'd just say, the essence of this bill, though it's a tax bill, for most people, the effect of this bill would be a reduction in taxes. And for some people and businesses, it would mean an increase in taxes, but the vast majority of people would not experience that increase. And closing this kind of tax avoidance is expected to raise an extra $1.6 billion per year in new revenue for Maryland. If you've been following the discussion at the state, they're really struggling with revenues. They've found that they're no longer able to fund the Transportation Trust Fund. Other sources of revenue, like the gas tax that have been going into that fund, are in decline, and that decline is expected to continue. And so while the states had very ambitious programs like the Blueprint and very aggressive goals for early childhood education and on the environment, all of them are being challenged by the inability to raise taxes. And most legislators are not interested in raising taxes if it means increasing the taxes on residents. So we kind of face, an inflection point in how we think about things. And we can either decide we're not raising taxes at all on anybody, in which case we'll never be able to achieve the things we talk about or aspire to, or we can decide that a fair tax system that collected money from people who basically avoid paying taxes would have the twofold benefit of reducing the burden on most households, as well as providing enough money for the state to try to achieve some of the important goals that it's set for itself. We've fallen behind our neighboring states, too many others in the nation, when it comes to building a strong economy. To be competitive, we must deliver tax relief to more Marylanders and ask our successful corporations to contribute more for the good of the state overall. And making a tax code change in which we tax capital gains like income from a paycheck can go a long way toward this goal. This is, another one of the problems the state struggles with. If in Montgomery County is a great example of being tax competitive, where the secret to success. This county ranks as like second lowest in residential and lowest in commercial taxes. Obviously, there are other things that are important. And across the river, Virginia, which taxes its corporations and developers far more, and I mean far more than Montgomery County, they're able to take that money and they treat that money as an investment. They build infrastructure. It makes their downtowns and their transit centers more attractive and more effective, and it helps them draw businesses there. The mentality in Maryland that everything is an expense and that's something to be avoided ignores the fact that a lot of times, an expense is really an investment, and people actually make money on their investments. And that's what other people are doing. That's what Maryland has to start doing. There's a strong coalition of organizations that support the Fair Share Maryland plan, including representatives like teachers, service employees, as well as nonprofit organizations. And I stand with these groups and the governor in asking for the kind of changes to put more money in the pockets of working families. And just as importantly, that these are not the kind of adjustments that impact families and taxpayers broadly in the state, other than being beneficial. Delegate Julie Polakovich Carr is sponsoring an identical bill in the House, as she told Maryland Matters, The reason this is needed is because today, the wealthiest 1% of Marylanders pay the smallest share of their income on state and local taxes. So looked at another way, what they're not paying in terms of taxes, and by them paying less than a fair share, that means the rest of us are paying more than a fair share. It's time to rectify that. Also this afternoon testimony was heard in the House on the Housing Expansion and Affordability Act. You all know I'm always looking for ways to bring innovative projects within Montgomery County in order to produce, protect, and preserve more affordable housing. It makes sense that the state's also making housing a high priority because it's such a key component in our economy. We finally have a governor who sees the value in making sure everyone can afford to live, work, and thrive in the state. Adjustments proposed in the state's Housing Expansion and Affordability Act with clear roadblocks that can prevent property owners or local property owners from being able to do projects they want to do, and that are sometimes used by local governments to prevent affordable housing projects from being added to communities across the state. On the bright side, in my time in this county, the council has not passed legislation to treat affordable housing construction differently than other kinds of construction in order to block it. It's not necessarily true everywhere else. It's important that we take steps to find ways to increase and preserve the supply of affordable housing. In Montgomery County in 2000, we had almost 43,000 affordable units. They were called naturally occurring because they weren't part of the MPDU program. They didn't have any other federal or state controls on it. They were just out there in the community and affordable. By 2020, that number had dropped to 22,000 units. That's a decrease in nearly 50% from the 43,000 units in 2000. But those losses are not due to zoning changes to exclude affordable housing. Those losses are rather because of the lack of controls the county had to protect affordable housing, partially corrected in the rent stabilization bill the council finally passed this year. And also, it's been affected by rezonings that replace existing affordable housing units with more expensive ones. We don't have policies that require one-for-one replacement when a developer is knocking down an affordable complex. They have no obligation to replace the units that existed, and that has contributed to the ongoing loss of units in Montgomery County. That and rising rents, the two greatest villains in that area. Since I came to office in 2019, our Department of Permitting Services data shows we've added nearly 15,000 units. That with that rate by 2030, we'd be pretty close to adding close to 35 to 36,000 units or more. That's a good thing, but it's not nearly enough, at least if you believe the projections from Montgomery County. Montgomery County currently has more than 20,000 households who are severely housing cost burdened. That means that you're paying more than half your income on rent if you make $31,000 a year. And at the 50,000 income range, more than half of the households, more than 50% of, more than 50,000 households are earning less than 50,000 a year and paying 50% or more on housing costs. My recommended capital improvement budget for FY25 and 2030 includes $200 million to support affordable housing. And I'd like to see another $50 million added from county reserves by this summer to help us protect more projects in the county and to enable us to build more in the county. Affordable housing remains a top priority for me and my administration. I'm happy to support statewide initiatives that will add $115 million for priority housing and investments in the state. I want to recognize that within the past week, we marked 1 year since the tragic apartment fire in Silver Spring that killed Melanie Diaz. Since that time, her family has been pushing for the kind of reforms that may have saved her life, would undoubtedly save the lives of others. Melanie died as she was trying to escape a fire in her building with her 2 dogs. The building did not have sprinklers, like many newer units are now required to have. State law on the books would not require older high-rises to have sprinklers until 2033. In Annapolis, a bill introduced by Delegate Lord Charkoudian would require a smoke alarm in every unit of a large apartment building without sprinklers. She's named in the Melanie Diaz Fire Safety Act, and a proposal by Councilmember Stewart would require property owners to share information about a building's fire safety plan with residents when they sign a lease. And I support all of these efforts to make our community safer and prepare should such a disaster strike. And we do occasionally get fires in our high rises. Last week, I mentioned the new addition to our Department of Health and Human Services, Dr. Nina Ashford, will serve as our Chief of Public Health Services in the county. She has extensive experience with public health programs as a teacher and a researcher, and I'm really pleased to welcome her to Montgomery County. And so I'm going to ask Nina to say a few words. And thank you for joining us.
Yes, thank you for having me, and thank you, County Executive Elridge. So I'm very excited. This is day 2 on the job, and I'm excited to get to integrate it into the work and get to know the team. I do want to thank Dr. Rogers for his leadership over the past year in this role. I'm very much looking forward to the opportunity to engage with the community, hear what the most pressing needs and concerns are, and continue to deliver on the excellent portfolio of work of public health services. So I look forward to meeting many residents, community groups out there, and hearing your feedback on how we can best meet your needs and serve you. So I look forward to seeing you.
So thank you, Dr. Ashford. And I'm going to turn it over to my health team, and you can ask them any questions. If you want to ask Dr. Ashford any questions in the process, feel free. So back to you, Lorna.
Thank you, Mr. County Executive. Dr. Bridgers, Mr. O'Donnell, do you have any opening remarks today? Go ahead, Mr. O'Donnell.
No, I was just going to share that we continue to monitor the respiratory disease transmissions in the county, and we have seen a little uptick in our flu transmissions, predominantly among our younger school-age kids and young adults going to outpatient centers and emergency departments for treatment. We haven't seen that translate into hospitalizations at this point, and we hope it stays that way, but urging caution to our seniors and those with underlying conditions to just be careful. There's still a lot of flu and COVID that is being spread out there.
Thank you, Mr. O'Donnell. Dr. Stoddard? Nothing?
No comments to start.
None for me on it.
Okay, so we're going to go ahead and open it up for questions and answers from members of the media. Please raise your hand if you have any questions for the officials this afternoon. Any questions from members of the media? Going once, going twice? I guess not. Thank you, everybody, for joining us. Thank you, Mr. County Executive, Dr. Ashford. Thank you for joining us in your first media briefing. Next time you'll get questions. Everybody stay safe. We'll see you next time. Have a great afternoon.